Good morning everybody, it's Eve from Thrive here, clinical nutritional therapist and associate naturopath. And this morning I'm talking to all the men out there, or ladies who care about their men out there. So we hear so much in the media about the menopause, but how many of you actually really know what's going on with the menopause? So in our trade we actually refer to it as an andropause because the term androgenic refers to male hormones such as testosterone, DHEAs and a few others. So what happens is around the age of 40 onwards, a man can really suffer with their decrease in testosterone and their male hormones. Now, when you're 20 and you're a man, you have loads of testosterone. And when you're 80, you don't want that. Or you might do, but most people don't want that. So Mother Nature gradually tails off testosterone nice and gently into old age. However, sometimes for some men, when they're in their 40s, it can drop off a cliff very quickly and they can get some really nasty symptoms. And it can be really, really miserable for some men. So some of the symptoms that you might notice, well, first of all, most of them are largely related to sexual function. So decreased libido for a start. So are you really not interested in sex, not bothered about sexual contact at all? Erectile dysfunction, and that can be anything from waking up in the morning and your morning erection is either missing or just nowhere near what it used to be. Difficulty maintaining an erection. All sorts of erectile dysfunction problems. So besides those kind of symptoms, a man can feel very tired, really fatigued and exhausted, like they're coming from work and they just cannot lift their bodies to do one thing further. For some men, it's so bad that they can't work. Mood. The mood can go really down and depression can be quite common, or definitely a very low mood. Feeling like you're not as physically strong as you used to be. You really notice, like when you're lifting bags of things, that you just find it more difficult than you used to. Or if you would go to the gym, you might find it more difficult to pump the usual weights that you usually do. You might feel the actual muscle tone is different. And that's because as testosterone lowers, it can cause all those problems and decrease your strength. Body hair, your body hair can become more sparse. Your beard might not be as thick as it used to be. And just generally feeling like you're so unmotivated. So testosterone is what gives you virility and gives you drive and gets you out there in life. And as that drops, you can feel like you just want to stay at home, put your slippers on and watch EastEnders rather than go out. You want to stay at home, can't really be bothered to do anything. You've got absolutely no drive. So all of these things paint a pretty miserable picture, don't they? And it's not how it's supposed to be. You're not supposed to have your testosterone levels plummet like a stone in a swimming pool, but for some men they do, and it's usually because of dietary and lifestyle factors or some kind of medical factor. So I do a health check, and it includes a blood screen which will check all your male hormones. And it will look at your testosterone levels, it will look at your DHEAs, it'll look at something called sex hormone binding globulin, because if that is high, then you might be producing lots of testosterone, but that sort of sticks to it and stops you being able to use it. And so there's some really easy ways of lowering that. In addition to this, just checking your hormones, it's also a nutrient check, because like ladies, if your nutrients are depleted, you will have worse hormonal problems. So I say to ladies, your menopause and your periods are like a school report coming home telling us how well you're doing. If you are nutritionally low in certain areas, then you're going to have worse menopause problems. You're going to have worse periods. And it's the same with men. If you're nutritionally low, your metabolic power isn't what it should be. You're not firing on all of your cylinders. It's like putting diesel in a Ferrari. It's just not going to go. you need to make sure that your nutrition, your nutritional content is on point. So this checks the key areas of nutrition. And these are things that if you have taken at the doctors, they might tell you that you're okay, because the doctor's ranges are really, really massive. And they're also, it's just very different how we do it. We use optimal levels, and people really respond with symptoms improving and good health by aiming for those optimal levels. So in addition to that, the screen also checks your PSA levels, which is a marker, is the word I'm looking for. It's a marker of the health of your prostate. So other symptoms that you might get if your prostate's a little bit wonky, so you might have difficulty maintaining a stream of urine. Might stop, start, might be quite dribbly at the end of the penis. You might really feel like you need to go to the toilet and then you can only do a tiny little bit. You might have urinary leakage. You might be up in night having lots of wheeze. So your prostate is important to know how that's doing. So that's also in this screen. So a few things you can do in the meantime to help yourself with any symptoms of low testosterone. So diet and lifestyle are key. They are the reasons that Mother Nature's got a bit confused and you've gone a bit low too quickly. Sleep is so important. If you are not getting the minimum of 7 hours of restorative, productive, uninterrupted sleep, it's going to take its toll on your testosterone levels. It's just black and white, it will. So really get a good sleep structure, sort it out. What's preventing you from having good, restorative, uninterrupted sleep for 7 hours? Obesity and weight gain will cause your testosterone levels to drop. If you are putting on weight around the middle, you need to lose it, because those fat cells will produce estrogen in a man. And as soon as your estrogen starts rising, you're just out of balance. The whole thing goes like this. So you need to remove it. Another reason is it causes what we call insulin resistance. And insulin resistance has a massive effect on our hormones. In ladies, it causes horrific problems. And in men, it will cause your testosterone to lower. So it's very important to get to grip with your diet and lifestyle. So if your results come back and it says that you are really, really, really low in testosterone, then I will refer you to your GP. I'll write you a letter, because testosterone therapy is not something that I'm licensed to do. And it's not something that's always the best solution to a problem. You've got to sort that diet and lifestyle out first, guys, because whilst testosterone therapy is great for some people, and you can get it as a cream, an injection, some you can get as a pill, you can get a little pellet that you have inserted and it dissolves. Whilst it can be effective for some people, it does come with risks. So it will raise your blood count and make it more likely for you to have a stroke. It can increase arterial deposits of plaque, making you more prone to coronary artery disease. If you already have sleep apnea, it will worsen it. So there are the downsides of testosterone therapy. So I do say to ladies that come to me, and it's the same for you guys, there is no fountain of youth hormone. There's nothing that's ever going to keep you young forever, because we're not supposed to stay young forever, you know? We've got to make room for the young ones that are coming up. However, the fountain of youth, if there is one, an elixir of health, is your nutrient level. You are like a Ferrari, and you need to pamper yourself like a Ferrari. Give it the best oil, the best fuel. I don't know a lot about cars, but I'm sure you add lots of other things to it all to make it really nice and very powerful. And it's the same with you. You've got to get that nutrition on point. You've got to be giving your body everything it needs for it to function, because your body is basically a machine and it needs things to work properly. So my check that I do also includes a one-to-one with me. So about a half-an-hour session where I can give you advice, give you any recommendations for nutritional supplements, inject you if I need to with anything nutrient-wise, and just get you back on the straight and narrow, give you the lifestyle advice, anything else I can think of. So you get your screen, it's a finger prick test that you do at home, and we send it off to my laboratory. The results come back very quickly, then we meet up and we get you back on track, so that hopefully you're not just wanting to have a cup of tea and watch EastEnders anymore. You get a little bit of that spark back in life. And because if you're only in your 40s, you've got a long way to go. It's important to get that spark back and start enjoying things again. All right, have a lovely day. Thank you. Bye.